Hi Caroline, my name is Lindsay. I'll be doing your motor examination today. Can you please tell me where you're located and what the date and time is?
It is at Carolinas Medical Center. It's October 15th and it is 6:20 p.m.
Okay. And can you please count in multiples of 7 just a few times for me, please?
7, 14, 21, 28.
Okay, good. I am also inspecting the patient's skin while I am talking to her. I'm just looking for bruises, rashes, or any lesions, and nothing is noted. I'm going to also feel the temperature of the patient on the legs and feet also. Can you undo your feet? Okay. And I'm going to see the texture of the skin, and it's good. It's nice and smooth. And I'm also going to check the patient's skin turgor. Okay, good. I am also going to look at the patient's hair distribution. Okay, and it looks like it's evenly distributed. That's good. And I'm also going to check the patient's nail beds. Okay, and also the toes. Okay, and can you please put your index fingers together? Just want to look for some clubbing, and nothing is noted. Okay, I'm also going to check the 9 lymph nodes of the patient. I'll move the camera just a little bit closer. I'm going to make sure that it's still recording. Okay, and I'm going to check the occipital, which is in the back of the head, behind the ear, front of the ear, the tonsillar, the submandibular, and the submantle. Going to do the ones behind the sternocleidomastoid, and also in front, and above the clavicle also. Okay, and do you mind shrugging your shoulders for me? Okay, and then doing it again against resistance, and then push your head against my hand, and also this side. Okay, good. I am also inspecting the patient's neck, and I don't see any distension noted at all, and it looks each side. Can you lift your chin up? It's going to check for the trachea and make sure it's midline, and also a tracheal tug. And I'm going to also now check the patient's thyroid and give her a cup of water. Okay, there you go. And if you could just take a sip of water and don't swallow it, and tilt your head to one of the sides. Okay, and swallow. Okay. And swallow. Okay, good. Also going to check the patient's sensation. I'm going to put a cotton ball on her hand so she knows what it feels like. Okay, and please close your eyes and tell me when you feel it. You feel it?
Mm-hmm.
Tell me when you feel it.
Yes. Yes. Yes.
Okay, good. Now I am also going to check the patient's TMJ and one of the facial muscles. Please open and close your mouth. Okay, and then clench your teeth. Okay, good. And I'm also going to check the patient's muscles in the face, so if you could frown for me. And then smile. And then purse your lips. And go ahead and clench your eyes and don't let me open them. Okay, good. And go ahead and puff your cheeks out. Okay, good. Okay, so the patient has good symmetry with the eyebrows, the eyelashes. I'm now looking at the eyes. I also see white sclera, and I'm going to ask the patient to look down as I feel around her eyelids. Okay, open your eyes for me and look down. Okay, and then look up. Okay. And do you feel any pain around your eyes?
No.
Okay, good. Also going to palpate the patient's sinuses. Tell me if there's any pain.
No. No.
Okay. Going to feel the patient's head also, and for any lesions or bumps. And I don't see any lesions, and no bumps are felt. Okay. And I am also now going to have the patient, I'm going to get my pen light out. Go ahead and just look straight at me. Check the corneal reflex, and that's good. Also going to check the consensual and the direct. Okay. Okay, good. And I'm also going to have you please stare at the biohazard box over there. Okay, and then focus on it on the pen. Okay, good. And can you close one eye for me, cover one eye, and look at the pen, and then take your hand down. Okay, and then the other eye. Okay, good. Now I'm also going to do some peripheral vision tests with the patient as well. And I'm going to be covering one eye as well as the patient while she's doing it. Okay, so go ahead and cover one eye for me. I'm going to cover one, and tell me when you see the fingers while you're looking pretty much straight at me.
Yes. 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 Yes.
Okay, and the other eye?
Yes. 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 Yes.
Okay, good. I'm also going to have the patient follow the pen light with your eyes instead of your head. Okay, and then also up and down. Okay, good. Going to check the patient's eye now with a certain device. I'm going to make sure that it's on. And the correct way to use this device is my right hand, my right eye, patient's right eye, patient's left eye, my left eye, and my left hand. Okay? Okay, and the optic disc is an orangey pearly gray in both eyes, and I also see a red reflex in both eyes. I'm going to turn my device off now. And now we are going to inspect the patient's ear. Okay, just want to make sure that this is still recording. Okay. And I'm just looking at the ear, and I don't see any lesions, any scaliness. Going to look behind the ear. No lesions. No breakdown. Any pain or tenderness?
No.
Okay, we're going to do 3 tests with the ear, and the first one is the whisper test. So if you please cover one ear. And I'm going to whisper some numbers in your ear, and please repeat them after you hear them.
4, 6, 10.
Okay?
2, 5, 10.
Okay, good. Going to activate my tuning fork now. Okay, and please tell me when you hear the vibration and if it's the same in both ears.
I hear it, and it's the same.
Okay, I'm going to activate it again.
I hear it.
And tell me when it stops.
It stopped.
Okay,
I hear it. And it stopped.
okay, and we'll do the other side.
I hear it. It stopped. I hear it. And it stopped.
Okay, good. Okay, so those are the 3 tests for the ear. Now I'm going to take a visual look inside of the patient's ear. To put my device together, okay, can you please tilt your head? Okay, and I see a pearly gray tympanic membrane in that ear, and do the other side. Okay, and also see a gray pearly tympanic membrane on that side as well. Put my device down. There was no earwax that was noted. We also have one more eye test to do. And if you could go ahead and just cover one of your eyes and then read the very last line if you can see that aloud.
DEF POTEC.
Okay, and the other eye?
DEF POTEC.
Okay, very good. Thank you. And now we're going to inspect the patient's nose. And I'm just looking at it, and I don't see any lesions, I don't see any bumps in the nose or any rigid areas. I'm going to feel it. Any pain or tenderness?
No.
Okay, going to look up the nose. Okay, mucous membranes are pink and moist. I don't see any lesions up the nose either. Okay, I'm also going to inspect the patient's mouth. I'm looking at the outside of the mouth, and I don't see any cracks or any sores on the outside of the mouth. Lips are moist. Okay, go ahead and open. Okay, all the teeth are intact. Can you lift your tongue up for me? Okay, and go ahead and say ah, ah. Okay, teeth are intact. Her mucous membranes are pink and moist. No lesions at all. The uvula does raise when she says ah. I'm also going to ask you to stick your tongue out and move it side to side. Okay, good. Going to do another exam with the tongue. That's a little bit uncomfortable, so we're going to have you stick your tongue out. And I'm going to just grab it. I'm just going to move it side to side. Okay. Okay, no lesions noted, since that's where most lesions are found and they hide. Put my glove away. Okay, so I'm also going to check the sensation of the patient's face. So I'm going to have you, I'm just going to put this on the back of your hand so you know what it feels like. Okay, go ahead and close your eyes and tell me when you feel.
Yes. 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 Yes.
Okay. And now I am also going to listen. I'm inspecting the patient's chest right now. I'm going to ask her to please drop the gown down. She has a tank top on underneath. Okay, take a few deep breaths for me. The chest rises with ease, no labored breathing noted. Chest rises symmetrically also. Okay. I'm also going to do another facial test that I missed, and that would be, I'm going to check your TMJ. Go ahead and open and close your mouth. Okay, and clench down. Okay, good. So the facial muscle is there, the masseter, and the TMJ is good. And I'm also going to ask the patient to smile, frown. Go ahead and clench your eyes down for me and don't open them. Okay? Open them and purse your lips. Okay, and puff your cheeks out if you can. Okay, good. And do you have any pain around your orbital, your eyes here?
No.
Okay, good. Okay. That's just to add on to that. Just going to make sure this camera is working.